Postnatal Stages, a workshop for health professionals. So my name is Christine Turner. I'm the Chief Operations Officer. Our lovely speaker today is Melissa Cotterill. She is the Prenatal and New Baby Manager for the Congratulations Initiative at Down Syndrome New South Wales. Melissa is extremely passionate about education and awareness. She has many years of experience working with families and people who have Down syndrome across all ages, and has worked across many programs at Down Syndrome New South Wales. Melissa and her husband have 4 daughters, one of which has Down syndrome. So her 18 years of lived experience parenting her beautiful daughter who has Down syndrome fosters her passion to be part of the Congratulations Initiative team. So this workshop will be informative and interactive. It will help to equip health professionals in delivering a prenatal, postnatal diagnosis of Down syndrome. We're going to go into some real life stories as well and experiences, and there will be opportunities to ask plenty of questions and have discussion as we progress. So I do ask, if you have questions or comments, please pop them in the chat, or if you'd like to save them until the end, and Melissa can talk to those as well. We have a range of information and resources on our website. We also have a health professionals request form. So if you're wanting more information, or if you're wanting a medical professionals pack or further in services, there's a form that you can fill in to get that. I'll pop all of this into the chat as Melissa begins the presentation, so that you can access the additional resources. We also strongly encourage membership to Down Syndrome New South Wales, so that you've always got access to up-to-date information and access to these type of free workshops. So I'll also pop that in the chat. Our membership is free of charge. And I might hand over now to Melissa for the good stuff to kick off with the Congratulations Initiative presentation today.
Thank you so much, Christine. Welcome everyone to our Congratulations Initiative Down Syndrome in the Prenatal and Postnatal Stages. So our workshop today will just take a little bit of a deeper dive into best practice for giving a prenatal and postnatal diagnosis. And here we go. So today we'll cover an introduction on Down Syndrome New South Wales, the Congratulations Initiative, a little bit about Down syndrome in Australia, and best practice in delivering a diagnosis in a non-biased way for prenatal and postnatal strategies, co-occurring health conditions, and we'll play some videos of real-life parent stories. So about Down Syndrome New South Wales, our vision: all people with Down syndrome in New South Wales live meaningful lives as valued and contributing members of their communities. We advocate for change to achieve social transformation by building systems that promote self-determination. We create opportunities for people with Down syndrome that promote connection, capacity and autonomy. And we provide information and support to families, carers and supporters, informed by evidence and lived experience. And as Christine mentioned before, our services cover the whole lifespan, including prenatal, in the baby space, early years, teenage years, transitioning to school, inclusive education support, training for teachers, behaviour management, right through to community engagement, health, ageing advice. We run advocacy and support, guardianship and wills. And our lovely CEO, Emily Kasker, just last week, she presented at the United Nations Conference of State Parties, and she presented on unemployment rates and employment rates for people with intellectual disability in Australia, and just how employment matters, because our people with disability, our loved ones with disability, do matter. But there's still a long way to go in this space. But she also showcased the wonderful partnership that we have with one of the country's biggest football teams, and that's the Sydney Swans. So that's something that, yeah, we celebrated as well. Sorry, and our Congratulations Initiative, it basically has 3 streams. We positively partner with medical professionals. So we aim to upskill medical professionals in their delivery of a diagnosis and bring them up to date with information about Down syndrome. And we do that through our in-services like today, online or face-to-face. And we've got our medical professionals packs. And we really aim to be a key support partner and helping medical professionals to say congratulations and not sorry when giving a diagnosis. Prenatal and diagnosis support. We provide expert advice backed up by lived experience in the prenatal stages, and we work to ensure that all parents have up-to-date, fair and equitable information and support. And of course, we celebrate babies, new babies, and through the early years, through hospital visits, parent support networks, individual guidance and support, workshops and resources to families, because we want them to have the very best start in life. So our why for our congratulations initiative. So we know that more than 90% of pregnancies with a diagnosis of Down syndrome choose to terminate. And whilst we absolutely respect the choice of families, we know from these same families that is often based on very outdated information, unrelenting pressure to terminate, and discussions about limitations and not possibilities. At what is probably the most vulnerable time in parents' lives, the words a medical professional speaks, whether that's negative or positive, and the care they provide stay with them forever. And this experience cannot be forgotten. So we know that we can do better. And I've just got a quote here. It would have been such a great experience if we received a congratulations from the medical professionals instead of an I'm sorry. If we could change one thing in the system, that would be a big one. And that's from Sean, who's a dad of a 2-year-old son who has Down syndrome. So how we partner with health professionals. So we provide our medical professionals information packs, our Congratulations Initiative quarterly magazine that's coming out very soon, our website, which is full of resources, research and fact sheets, seminars and workshops on health matters, also conferences. We have a health conference each year. Our special dedicated email for our congratulations initiative, and we run in-services training and working on online training models as well. And how we nurture and support families. So we provide prenatal information kit, a new parent introduction folder, new baby welcome kit that we send to new parents, home, hospital calls, FaceTime, and that's in the prenatal and postnatal stages. Online Facebook, private groups, online catch-up. We run a fortnightly online catch-up with parents to connect with other parents, and connections to new babies' days and local connections and events. And we actually had our latest New Babies Day just last weekend, and we've actually got some videos to show at the end of this presentation that was taken at the Babies Day. So it's just a great space where families can come together, connect with other families, and the babies can all sort of socialize together as well. And then we also have expert speakers that talk on relevant topics for the parents to learn about as well. Capacity building, we have workshops, seminars, fact sheets, and conferences for our member families. So well-balanced information is what we're aiming for. So testing, information and consent, medical diagnosis, and all options available. So that's what you as medical professionals are really good at, and that's the part that you play. And then evidence based and up-to-date resources, fact sheets and research. So Down Syndrome New South Wales provides that. Real stories of lived experience and possibility. Connection to Down Syndrome New South Wales, and connection to families of loved ones with Down syndrome. So all of those services put together for expectant and new parents means that they're informed, supported and equipped. And it's our duty as trusted professionals to provide non-directive yet full information and support. So our intention, this is only the start of the Congratulations Initiative. It's been running now for 2 years in the current format, but Down Syndrome New South Wales was established in 1980. So it's been like for nearly 45 years, we're standing on the shoulders of parents who started up Down Syndrome New South Wales, and we're just continuing on from what they have started. And as their children sort of grew into the childhood years and teenage years and adult years. So too did the services of Down Syndrome New South Wales. So it's a huge honour and privilege for me to be part of the Congratulations initiative. So we hope to reach more medical professionals and university students, send out more educational packs, develop an online training course, digital assets and videos, and we look to partner with other organisations and disability types using our Congratulations initiative as a prototype for all. And of course, spread the Congratulations initiative message, as well as evaluate our huge impact. So a little bit about Down syndrome. So Down syndrome is the most common genetic condition. It is caused when a person is born with an extra chromosome. And this genetic condition occurs at the point of conception. And Down syndrome is a disability that impacts intellectual development, some physical characteristics and aspects of a person's physical health. And because no two people are alike, this will vary from one person to another. And people with Down syndrome have 47 chromosomes instead of 46, and they have an extra or third copy of chromosome 21, which is why Down syndrome is known as trisomy 21. There's actually 3 different types of Down syndrome. So trisomy 21, which is about 95% of the population that have Down syndrome have trisomy 21, and that's where every single cell in their body has the extra copy of chromosome 21. And then there's translocation Down syndrome, which about 3% of the population of people that have Down syndrome, that can be inherited. And it's where an extra part of chromosome 21 is attached to another chromosome. And then, of course, there's mosaicism Down syndrome, which is where not every single cell in the body has that extra copy of the chromosome 21. Physiological characteristics. So there's physical features when someone is born with Down syndrome. So there's the upward slant to the eyes, and they have those lovely almond-shaped eyes with the skin folding over the inner corner. Low set and small ears, a small nose with a wide bridge, a singular transverse palmar crease in the palm of their hands, a larger space between the toes and the second toes, and the round face and flat profile, and sometimes a slightly bent fifth finger. When my daughter Alyssa was born, one of the first things I noticed about her when I had a postnatal diagnosis was that her little finger was slightly bent. My experience with Alyssa was a very positive experience. So all through her life, it was a positive experience. So, and that's what makes me passionate about wanting other parents to experience a positive experience as well. So Down syndrome in Australia. So that's Alyssa there when she was 3 years old. So there's approximately 13,000 people in Australia who have Down syndrome. There's no actual data set of information that actually tells us exactly how many people in Australia have Down syndrome. 1 in 1,100 people in Australia are born with Down syndrome. It equates to about 290 births in Australia per year. It occurs across all ethnic and socioeconomic groups. And in Australia, as we mentioned before, 9 out of 10 pregnancies diagnosed with Down syndrome end in termination. So we'll take a little bit of a deeper dive now, delivering a prenatal diagnosis. So this is best practice from, you may have heard of Dr. Brian Skotko. So he's a geneticist. He has a sister who has Down syndrome. So he's very passionate about people who have Down syndrome. And he has, him and his colleagues have put together the Down syndrome diagnosis study group. And they put together best practice for prenatal and postnatal diagnosis. But it's very interesting because we speak to our Congratulations team, we speak to parents in the prenatal and postnatal stage, and it's very, very similar. So a lot of the information they're giving and negative sort of information is pretty much identical to what Dr. Skotko has put together here. So he suggested, so results from the prenatal screening should be clearly explained as a chance assessment and not a positive or negative result. And prior to CVS or amnio, discuss all reasons for prenatal diagnosis. Just on that, speaking to other couples, people have sort of mentioned to me, my screen has just gone, sorry. People have sort of mentioned to me that they felt that they had to have screening, and they didn't know that it was an option, that they didn't have to. So yeah, I think just sort of asking sort of parents, why they sort of want it, and if they sort of want it, just to be an option for them. Deliver the, sorry, that's gone. Sorry. Healthcare professionals most knowledgeable about Down syndrome should deliver the news, and most likely an obstetrician or a genetic professional together. And the news should be delivered in person, and if not possible, a phone call, but only at a pre-arranged time. So Dr. Scott Coe does give examples, and I've had personal experience with couples that we do speak to. People might be at work and they get a phone call, or they might be teaching in a classroom. Or one example is, someone was out shopping and got the phone call in a busy supermarket that, she had been shopped in for like 10 years, given the diagnosis over the phone and completely got disoriented, totally lost, couldn't work her way to get out of the shop. So these are all the reasons. So I think it's one of those things that when someone is given a diagnosis, it's sort of like a light bulb moment. It's sort of like you remember where you were, you remember the smells in the room, you remember, it's just one of those life-changing moments, because we all want to have a child that's healthy, and to receive a diagnosis that your child will have a disability, it's a bit of a shock. So all of that sort of needs to be handled very, very gently and face-to-face. The news should be delivered in person, and if not possible, a phone call definitely at a pre-arranged time. Answer, so what is Down syndrome and what causes the condition? Christine, a little bit later, she will put some information as attachments into the chat that you can use. So we've got all that information. And answer, what are realistic expectations for individuals with Down syndrome today? The life expectancy for someone who has Down syndrome today is 60 years, whereas, like 60, 70 years ago, the life expectancy was about 10 years old. So today is the best time to have a child with Down syndrome. There's so much healthcare and family support, education for people to live for a long and fulfilling lives. Offer connection with parent support groups, or chat with our prenatal specialist through Down Syndrome New South Wales. Use non-directive language and refrain from putting any bias to parents by saying, I'm sorry, unfortunately, or bad news. From talking to lots of people in the parents in the postnatal and prenatal stage, that's one thing that they don't want to hear. That people do want to hear congratulations, factual information, and just to sort of humanize that interaction. Offer up-to-date materials, and we can offer up-to-date materials definitely here at Down Syndrome New South Wales. So that's our phone number, and that's an email that you can contact us, and make follow-up appointments, including specialists as needed. So that's for the prenatal stage. Delivering a postnatal diagnosis, obstetricians and paediatricians should coordinate their messaging. Ideally, they would meet together with parents to deliver the news. I had a very positive experience. My paediatrician came in, Alyssa was born late at night, and I suspected that she had Down syndrome, but because there was no sort of doctor, my doctor left, and after I had delivered her, it was very late at night. There was sort of no doctor, and then the nurses couldn't sort of deliver that diagnosis. They did explain to me the next morning. But the paediatrician just was very factual, up to date, and had a lovely nurse with him. And they just spoke to my husband and I, and just explained what Down syndrome meant. And they didn't go into too much of what can go wrong with Down syndrome. But one thing they did mention was that babies with Down syndrome can have some kind of heart defect, but they didn't say that she did at that time. So it was just me sort of, and my husband just sort of processing, okay, what does this mean? Inform parents of suspicion for Down syndrome immediately, even if diagnosis is not yet confirmed. Deliver the diagnosis in a private room. I have actually spoken to parents that when their doctor was giving the diagnosis, that they had a room full of family. And yeah, I guess that's sort of like, yeah, that just sort of put her into a real sort of spiral. So things like that have happened before. So deliver the diagnosis in a private room, ideally with the couple, and also the baby should be present as well, and referred to by name. Always the baby referred to by name. Begin conversation with positive words such as congratulations on the birth of the child. One thing that parents do say is that they just want to be treated normal, and congratulations. I mean, they've got a baby first that just happens to have Down syndrome. Provide accurate, up-to-date information. Limit discussions to medical conditions that the infant has or might develop within 1 year of age. Another thing that parents sort of say to us is that medical professionals give them a huge long list of medical issues and problems that they say usually that will go wrong. There's no definite that a long list of medical problems to do with Down syndrome will in fact go wrong at all. So maybe, yes, there are definitely medical conditions that are unique to Down syndrome, but maybe just keep it to, whatever the baby is going through at the moment or has been diagnosed with, but definitely not a long list of, your baby will get this and this, all these scientific, the parents just don't want to hear that. Connect to local parent support groups and or other families. I know when I had Alyssa, I had a lovely nurse that came in the day after she was born, and she offered me a folder of information from Down Syndrome New South Wales, and she said, this is from Down Syndrome New South Wales, and would you like to have a representative come in and just meet you and just have a chat to you? So my husband and I said, yes, that would be absolutely wonderful. So when Alyssa was 2 days old, we had a lovely visit from a parent representative at Down Syndrome New South Wales, who just completely normalized the situation. She had a 23-year-old daughter at the time, and she was just able to, just tell me that everything, was, great in her daughter's life, that she had a sense of humor and everything that she was doing. And that just hearing that human side and that social side just really normalized everything, and just helped us to feel really at ease. Because I think, when you're given that diagnosis, there is fear, because it's like, what does this mean for us as a family, and what does this mean for our baby? But we just knew that we had this gorgeous little baby that we just wanted to do everything we possibly could for. And just to have that support network and information. And we weren't given a long list of things that could go wrong. Alyssa did have a heart defect, and eventually when she was 3.5, she did need open heart surgery. But it was something that the doctors had always hoped that the particular heart defect that she had would heal itself. So there was never, when we went to the cardiologist, it was never right, definitely, when she's 3.5, she will have to have this. There was a hope there that it would close over, but look, it didn't, and she needed surgery, and she came through absolutely fine. So connect to local parent support groups and other families is absolutely critical, and we can certainly help out with that. And follow-up appointments should be arranged as desired and needed. So anything but sorry. So women who have a prenatal diagnosis and who give birth to a baby who have Down syndrome are initially treading uncertain ground and will feel a wide range of emotions, including shock, grief, and fear of the unknown. but there is hope and a bright future. And now is the very best time to have a child with Down syndrome. So say congratulations and not sorry, and comment on the strengths, the gorgeous features, and see the baby and not the disability. And a baby with Down syndrome is going to have all the same wants and needs. It's going to be needs to be loved and nurtured, sung to, if the baby's got siblings, like it's just a really joyous celebratory time to have. So as I mentioned before, Dr. Brian Scotco put together all those, and as I mentioned, those examples that I gave are real life examples that we've experienced talking to couples that have a baby. So your key role as medical professionals, I think it's quite a responsibility delivering the news, whether it's prenatal or postnatal. And so just to encourage you, we work positively. We positively partner with medical professionals, and a parent's experience during prenatal care and upon the birth of a baby, whether positive or negative, will stay with them forever and have lasting effects. So information trumps fear. Factual and well-based information, well-balanced information about Down syndrome to enable women to make an informed choice in the prenatal stage. Medical professionals are the first point of contact for a woman when she finds out her baby has Down syndrome. A lot of the time it's just the medical professional and the couple, or it might be the woman on her own. And it's just in that, that private space that has so much responsibility is there. And so we just want to make that a really as much as positive an encounter as possible. Set the tone for what can and should be memorable and positive experience for all women and couples and their babies. Positive and inclusive language is very important. And once a diagnosis has been made, a referral to Down Syndrome New South Wales for ongoing support, information and connection to other parents and all our services and supports. And importance of connection with a paediatrician for ongoing medical checkups. And the benefits of early intervention, which include speech therapy, occupational therapy, and physiotherapy. All the research has shown that early intervention, it does work. I started Alyssa when she was 4 weeks old with early intervention, and it's with all of those therapies, and it honestly was the best thing. It's just like all her little brain receptors were lit up, and it was a weekly back in those days it was group therapy, but these days now there's the NDIS, and it's more like family based. So therapist is more like a one-on-one with the family, and just putting together strategies. Speech therapy, I often wondered, what speech therapy, why would my baby need speech therapy? But it's all about swallowing and feeding, that sort of thing. Occupational therapy for fine motor skills, and physiotherapy just to help with the baby's development, like sitting up, crawling, walking. And babies with Down syndrome do achieve all these things. It just takes a little bit of time and a little bit of help, but babies will definitely, and children with Down syndrome will definitely achieve all their milestones. So co-occurring health conditions. Now, this is a long list that a lot of parents do say, we've got this long list that we've been told that my baby is definitely going to get. There's no guarantee that every single baby will get every single thing. Every child is different, and not everyone will get all these health conditions. So some common ones, Down syndrome sort of goes with hypertonia, low muscle tone. There can be cataracts at birth, can be thyroid problems, duodenal atresia, can need operating on after the baby's born. Gastrointestinal tract malformations, including stenosis or Hirschsprung's disease. A heart defect, 50% of babies born with Down syndrome will have some kind of heart defect, the research says. Can have digestive or feeding issues, can have respiratory issues where they're more sort of susceptible to pneumonias, vision problems, hearing difficulties, obstructive sleep apnea, and aspiration. So my daughter, for instance, she did have a heart defect, and she did need open heart surgery. She doesn't have vision or hearing issues, but she does have obstructive sleep apnea. She's 18 now, and she wears a CPAP machine, and she's an absolute expert at that. Aspiration, she did have aspiration issues when she was a baby, and after some time of treating it as a cough and putting her on antibiotics, a speech therapist, which is why all the early intervention is so important. A speech therapist was watching me feed her one day, and she stopped and she said, "Hang on a minute, I think she's aspirating." So it was a quick visit to the pediatrician, and he just recommended food thickener in her sort of liquids and soups, and so we sort of had to go back to puree to start off with, and then sort of build her up again. And then it was just the swallowing mechanism. When that matured, when she was about 2, everything was fine, and she didn't need the food thickener anymore. So she definitely didn't have this long list of medical conditions, and she's a healthy, thriving 18-year-old today with a great sense of humour, I might add. So we've just got some parent stories now. Just before I play this, I just want to let you know also that back in March this year, Down Syndrome New South Wales, we had the privilege of appearing at New South Wales Parliament for the birth trauma inquiry. They had a hearing, and so we presented at that because we, just with all the negative information that parents are giving, it was really good. We put a submission in that just sort of, talked about the stories that our parents sort of go through, and just, submission on best practice of what could make it a better experience for parents. So I'll just play this one. So this is Joe, and this was just done last week. How would you give the diagnosis?
If I were to deliver the diagnosis as a doctor, I would be very clear that I'm doing so from a medical or healthcare perspective. I would then go on to add that to make sense of this news, the parents or the expecting parents most likely will want to hear other perspectives as well. Perspectives that a doctor is simply unable to provide. For example, other parents who have had children with trisomy 21, perspectives of therapists who have helped many babies and toddlers with trisomy 21 in their early days. All these different perspectives, sometimes conflicting each other, can be useful in guiding your next few days, weeks, and months ahead, or even years. A trisomy 21 diagnosis is certainly not something you can digest or come up with a plan with in an hour or in a day. In my view, it is very uninformed to come to a conclusion just hearing from a medical perspective.
What do you know now that you didn't before that you can share with medical professionals?
After the trisomy 21 diagnosis, it seemed common or typical every time we went to the hospital to be offered a social worker to talk to. While I appreciate this is part of their duty of care, I would say perhaps also be clear about the role of social workers when giving that offer. It is, in my view, unhelpful to say to the parents, "Do you want to talk to someone?" ? I think it's too broad. Rather, I would say ask more specifically. Do you want to talk with someone to talk through your feelings, if you need to work out your feelings, or do you want to talk to someone who has helped other families with similar diagnosis and can paint a fuller picture for you, assuming they actually can and have that experience. Otherwise, it can feel like that you're being handballed from one person to the next for no apparent reason or just for the sake of ticking the box.
And then there's just 2 other parents that at our baby's day that were happy to share their experiences. So I'll just play these videos as well. What was your diagnosis experience?
I was given 2 diagnoses. One was very early on when I had no nose bone, and I was in a medical appointment at the hospital and told by 2 men that there's a 1 in 10 chance she could have Down syndrome, and that was it. There was no empathy, there was no information, just that was that. And do I have any questions? Well, yeah, hello. You've just floored me with, a high statistic of information that's life-changing. And basically they referred me to genetics within the hospital, but then I had to go about booking that appointment, waiting. And then of course, this day and age, you consult Dr. Google. And, that's something that isn't always good, Google, because you do get a lot of negative and probably not a lot of positive. I wasn't going to have the NIPT, but upon several ultrasounds of Zariah's heart, when we finally found out there was an abnormality there, I decided to have the NIPT. Basically, when I Googled her heart condition, big red flag came up saying that 50% of all Down syndrome kids have this particular heart condition. So it was in that moment that I knew, but then I had an NIPT test. So went to the GP. Look, he didn't even know how to read it. He was on the back page reading out about genetic counselling or something, and I'm like, I could see the big red line. My heart had stopped in that moment. My eyes were welling up with tears. Anyway, he eventually landed on it. I said to him, I think that red line is where the information is, and he said about the high risk, and just basically read it off the piece of paper, gave me the piece of paper, and off I went. Look, I was doing some filming for a show, and so I was consulted in the car park with my wonderful cameraman, and in that moment is where I had to deal with the most life-changing information I've ever had. And then from there, you just consult every avenue you know to deal with it. But yeah, that was how I was given my diagnosis.
How would you give the diagnosis?
I think if I was a medical professional, now knowing what I know, I would be armed with knowing that the probability was there and having all the information before giving the diagnosis to me. So basically I was given it and then walked out, but he could have known before I walked into that room and had a whole bunch of literature or information, or who I can call, who I can talk to that actually have lived experience in this situation.
What do you know now that you didn't before that you can share with medical professionals?
What I know now is that Zariah is a human, a living, breathing being, not just a piece of paper with a diagnosis on it that you hand to a person, and she brings all the same joy that a typical baby would. And I would say that, it should have just been celebrated, excited, happy, and then just plucking all the positive information about who she is and what she brings to this world.
What was your diagnosis experience?
So I was told that I had a high probability of a child with Down syndrome by a phone call from my GP while I was in the waiting room to go to a appointment at the hospital. So I wish that I didn't receive it that way, but when I found out, I was really, really devastated.
How would you give the diagnosis?
Well, if it was me, I would have preferred to have a pre-arranged appointment to get that information, and for the GP to advise to bring a support person, no matter which way it was going to go. And that was already like part of the way they do it. So then you wouldn't be going into it thinking good or bad. You would have a support person no matter which way. And then you weren't taking it over the phone or by Zoom or anything like that. So knowing at that point that there was a high chance that we would have a child with Down syndrome, it was basically assumed from the medical professionals we were seeing at that point that we would have an amnio. Our GP in fact sent a referral, and an appointment was made on our behalf without us even having made a decision or been really consulted about that. And then further to that, our hospital staff at our ultrasound basically had said to us that we should have an appointment for the amnio, and if we chose otherwise, that we can cancel it. because then they went on to further say that if we waited, then there's a good chance that if we decided to terminate, then we would have to deliver the baby, which I would not do that.
So that was just some parents just last week that we were able to video. So it's the impact of a single word. And we've just got some other quotes here of some parents, but one that really stands out for me is Mary down the bottom here, mother of Sarah. And she said her pediatrician came to see her, and she said she remembers his warm words so clearly. And he said, "I'm not talking to you with a heavy heart. Sarah will bring you much joy. My role today is to inform you of what Sarah's needs may be so that you leave here more knowledgeable." So I hope that's been encouraging and that you've, have now sort of got equipped with some things to say, but we positively partner with medical professionals. So if there's ever anything that you need help with, there's lots of examples and, of lived experience that people have been through. And one of the things that Down Syndrome New South Wales, it's not about choice. It's just about providing up-to-date information so that parents have well-balanced information to make an informed choice. And I think, when you've got sort of lots of information on both sides, and that way, there's time to sort of just think about things and work out what to do. So we sort of give non-biased information as well, because we do speak to couples in that prenatal stage, and they don't know whether they're going to go ahead and keep their baby. I'm just sort of reading here. Another quote here, people weren't sure what to say to us. They mostly said they were sorry, which irritated, but we understood they meant well. And some said congratulations, and it was marvelous to hear. And a lot of the other things that we do hear from parents who are deciding to go ahead with their baby is that at every prenatal visit they are offered a termination, and that is relentlessly offered to them even after they say to their medical professionals to make a note to say, no, we don't want to be offered that. But that's every subsequent visit that they go to, they're offered that. So I thought if you wanted to